Welcome to More Than Miles, the podcast where we use storytelling and expert interviews to widen the lens on what it means to be a happy and healthy endurance athlete. We believe that athletes are so much more than their body, sport, and training miles. I'm Dr. Kate Edwards.
And I'm Dr. Kacy Sinders. We are endurance athletes, physical therapists, and huge coffee addicts. We spend most of our time treating, educating, and working with endurance athletes. Thank you so much for tuning in today. Now let's get to the show. Hello, everybody. Welcome to More Than Miles. Kate and Kacy here for more hard-hitting injury discussions. Today, we're going to be talking about plantar fasciitis. I've heard this one said incorrectly so many times. I think my favorite is plantar fasciitis. Plantar fasciitis.
Oh.
Yes, there's a lot of different names for this out there, correct and incorrect. But we're going to be talking about foot pain. What is plantar fasciitis versus perhaps some other origins of foot pain. But before we get into that, Kate, how are you?
I'm doing okay. I'm in upstate New York right now, and it is beautiful out. The weather is sunny, and there's a nice breeze, and I think it's probably in the 70s. So I'm wearing a sweatshirt and pants, which makes me super happy.
That's great for you. Love that journey for you. It's quite hot here in Atlanta. I thought I was going to die on doing my workout this morning. And so the character building is on full effect here in Atlanta. I'm happy that you're comfortable.
I've been kind of going back and forth between New York and Atlanta a lot this year. And we're coming back to Atlanta full time. Well, I say full time, but we still spend the summers in New York. So I'm in New York for all of July, and I have been for the last 5 years. But for some reason, I decided to move back right in the beginning of July. So I'm going to be there for the hottest month. And I think I'm going to have to wear an ice vest and get one of those fans that goes around your neck to like blow in my face. Otherwise, I'm not going to leave the house. I hate being hot so much.
Yeah, well, it does not take much, especially on a day like today. You know, we just recorded our previous episode was about Strava, and like scrolling through my Strava feed today, I didn't see a single runner who didn't complain about the heat today. So I was not the only one suffering out there.
Doesn't make me want to come back. I'm just saying, like, everyone keeps
I'm
talking
here, Kate. Just come back for me.
I am coming back for you, and it's going to be quite fun.
It is. It is.
I know. Okay, so let's dive into plantar fasciitis, plantar fasciosis, foot pain a little bit. And so I think we decided to have this topic because it's a very common injury or issue that runners deal with. And this is one of the kind of injuries and issues that runners tend to think that they don't need help with for a really long time until they can't walk. Have you found that same thing?
Yes, absolutely. Generally, plantar fasciitis, if it's true, plantar fasciitis will feel decent during a run. Like people can train through it because it, quote unquote, warms up and feels okay. So people assume that there's nothing wrong and that, they can just push through it. And you can to a certain extent until, like you said, you can't walk. So yes, this is something I do see quite often.
Well, and it's one of those things, if we can run, but we can't walk, it's kind of fine because we get to keep running. You know what I mean?
That's great because you know what? My number one rule is if you have pain with walking, you are not going to run.
I know.
And people look at me, they're like, that makes sense. But I disagree.
So.
I don't think so.
That's how we all think, of course. But that's also something I say. If you can't walk, you probably shouldn't be running, or we need to modify it. It's actually interesting that we're talking about this today because I was with my massage therapist earlier. And one of the questions he asked me was, what can I do about plantar fasciitis? I have all these people here that have it. And the only thing I know to do is to kind of massage the bottom of the foot and work through the calf and then offer them stretching. And I was like, oh, there's so much more.
So your massage wasn't relaxing because you were educating your massage therapist on plantar fasciitis.
Isn't that how it always goes?
Yes.
I like my massage therapist. He's pretty great. I don't mind talking about work because, that's all I talk about.
That's true.
So let's start here with some symptoms of plantar fasciitis. And you kind of alluded to some a few minutes ago. The big ones that should kind of give you a red flag or a yellow flag and say, maybe I should get this checked out, or perhaps this is some plantar fasciitis developing, is that when you first get out of the bed in the morning, if you have pain in the foot, typically right by the heel, but also sometimes into the entire bottom of the foot. usually starts by the heel. If you've been sitting for a long period and you stand up and you kind of hobble when you go to walk, that's the same kind of deal. The pain is typically sharp right in that heel, but sometimes, again, it can go throughout the entire foot. When you start a run, you will be a little bit uncomfortable, not feel that great. But then as you progress through the run, you're fine. So you think you're better and you can run as long as you want. And then as you stop, you cool down and it hurts again. Those are the big things that yell out plantar fasciitis to me.
Runners think that any kind of foot pain is plantar fasciitis. It's used as a catch-all diagnosis, even though it's actually a very specific diagnosis. And there's a lot of other things that can cause foot pain besides the plantar fascia or some sort of inflammation of the plantar fascia, especially on that insertion of the calcaneus or the heel bone, right? There's a lot of different things this could be. In fact, I just had a patient a couple weeks ago who thought they had plantar fasciitis, and he didn't have any pain in the morning, but would have increased aching as he kept walking during the day. It just didn't fit. And so I go, doing my diagnosis and all my palpation and things. And he's super tender, actually, to deep palpation of the bottom of the foot. So I needled 2 muscles in the foot, and he was pretty much fine from that day since. If it was true plantar fasciitis, I probably would not have gotten rid of all of his pain with 2 needles. But it's just a good demonstration that this can be a lot of different things. So in addition to being due to muscles in the bottom of the foot, there are trigger points in the gastroc soleus that can refer pain to the heel as well. So that is why, the calf is a big object of treatment when it comes to this sort of thing. But then this can be really broad. We can have pain in the heel that's from the lumbar spine and the back. So like a radiculopathy type situation. And of course, that's going to behave a little bit differently. We can have entrapment of the medial plantar nerve, which kind of runs right in that same area, which can be actually concomitant with plantar fasciitis. And a good physical therapist will be able to diagnose that for you. We can have calcaneal stress fractures, which is definitely a rough injury, but that's one that can happen. And then the other big one I look at, so in our heel, we actually have a fat pad, and we have these fat pads all over the body, and they help kind of cushion the joints and things like that. And we have one in the calcaneus, and over time, we can get atrophy or kind of a wasting away of it. All of our fat pads are really highly innervated with nerve endings. So if there's any disruption to that area, it's likely going to be painful or uncomfortable.
Sometimes it's not one, it can be multiple. And so especially people who have had symptoms in their foot for a long period of time, even if they have true plantar fasciitis, they may also have a lumbar component of it, or other pieces might start to pile on, especially if they've been suffering from it for months or years or whatever. And so most often, those cases of plantar fasciitis that go on and on and on and haven't been able to get better, the reason they're not getting better is because there's multiple issues that need to be addressed. And just working on calf strength, calf mobility, flexibility of the foot and ankle, soft tissue in the foot, and like glute strength and foot strength is not going to do it. It's really not going to get it better. And a lot of people just think that they've been working on it for a long time and this is where they are and they're not going to get any better. But a lot of times it's just, you need to get further into it, into the diagnosis.
Yeah, that's a great point. And I'm glad you brought it up because it is one of those diagnoses where I hear like, I've been dealing with this for 3 years, things like that, which isn't crazy given our population, but at that point, we've got a lot more layers to it, right? So acutely, maybe, rolling the bottom of your foot and using the whole ice water bottle trick and stretching your calves might be able to keep it at bay. But, as it goes with any injuries, like these things are warning signs. These are indicators that there's something going on, that your body isn't adapting to your training load or how you're running, or there's something biomechanically going on. So the earlier, the better. And I think that this goes for any injury, but seeking medical help earlier rather than later is always key, I think, to avoid those kind of very complicated cases.
That's true. And usually, if it's been going on for 3 years, there is a nerve component. So almost always there's a nerve component because they get, it just kind of gets trapped in the soft tissue, and the nerve needs movement, blood flow, and space, and it doesn't get that. And so if you have been dealing with it for a long time, you want to make sure your therapist knows how to do like neural mobility and check the lumbar spine as well, which I think is really, really important, even if it's acute, but definitely if it's chronic.
Yeah, absolutely. And I mean, we talked about this too with our Achilles episode too, talking about the sural nerve being involved in chronic cases too.
Yeah.
And, there's, like you said, there's a lot of reasons why that can happen. But so when we think about these connective tissue injuries, right? So if you think about running as a repetitive strain or repetitive kind of micro tearing, our body, goes, oh, I got to go fix that. And so, your body sends all of these good cells to go and take care of it. But guess what? You go and run again the next morning, and then again, and then again. And before you know it, those cells haven't been able to do their job correctly. What was once nice linear collagen and connective fibers. I'm gesturing with my hands, but you can't see this. So Kate, maybe you're right. We should have this on YouTube.
Coming to a theater near you,
yeah,
or a YouTube channel near you.
YouTube channel near you, become a star. So anyway, the fibers that were once nice and parallel are now really disorganized. And when we think about how our nerves have to travel through, our nerves want a nice straight track. They don't want to go through roundabouts and things like that. And so I know you love my anatomy analogies.
I do.
And so that's what leads to this neural component over time. So the more disorganized those connective tissue fibers become, the worse movement in general we get. And this affects everything that passes through there.
Yep. And I think that also thinking about the anatomy of the foot, we have to realize that the plantar fascia is the bottom part of the foot, right? And it attaches into the medial calcaneal tuberosity, which is like the one spot that really hurts if you poke your heel and you have plantar fasciitis. That is continuous with the Achilles tendon, with the gastroc, with the soleus. So the soft tissue that goes up to the back of the leg and actually all the way up the posterior chain or the back of the body. And so you really can't just treat the foot because it's all continuous if you think about the anatomy. And then you have all of these little muscles that are at the bottom of the foot that also are impacted. So one of the muscles you probably needled in that person that you're talking about was quadratus plantae, or some of the foot intrinsics, because a lot of times those also get really sore and really tight, and the trigger points can create and mimic some of the pain of plantar fasciitis. We also have to think about the arch type. So some people have high arches, some people have more of a neutral arch, and some people, their arch is more of a flattened arch. And the way that our foot hits the ground during running and the impact that goes through our foot also impacts whether or not we're going to get plantar fasciitis, or how much pressure we're putting on the plantar fascia, or if we already have plantar fasciitis, how it's going to respond. And so somebody who is a big overpronator or pronates for a longer period of time may be at higher risk for plantar fasciitis because it's just constantly being stretched with every step.
Another thing kind of to note about arch type 2 is that there's different reasons why the plantar fascia might get strained in a lower arch versus a higher arch, but both are predisposing factors for it. Yeah. Not saying that you should panic if you have one or the other, but it's not exclusive. Like if you have high arches, then you're more prone, or if you have low arches, you're more prone to this. Both kind of extremes can lead to this potentially just because of the mechanics that are involved. That's where kind of some specialization in terms of like shoe wear and, training surfaces. And that's where you have to kind of learn to work with your own body and kind of figure out what's going to be best for your foot specifically. And this is why we work with some really good running stores on that.
Mm-hmm. That's right. And also why we do strengthening of the foot and ankle complex and glute strength. So and core strength and breathing and posture and running form, all of those things can come back to plantar fasciitis. In fact, if you have plantar fasciitis, it doesn't get you out of doing glute strength, breathing, and core work.
Right. It's not all towel scrunches, folks.
It isn't all towel scrunches or the marbles. That's one of the first things I learned in PT school is to get the marbles with your toes.
Oh, gosh. I remember that as a student. I cleaned so many marbles.
But now there's toe yoga as well. At least you're not dirtying up any marbles with that.
That's true. That's true. Can I get on my soapbox about towel scrunches really quick?
I'd love it. It would make me so happy, please.
Okay, so it's not a bad exercise. It does strengthen certain muscles of the foot, including the foot intrinsics. Now, they're more of a foot extrinsic dominant exercise. So when we look at the structure of the foot, we have muscles that are unique to just the foot, and they have insertions and origins that are only on the bottom of the foot. And then we have extrinsic muscles, which are actually the muscle bellies are located in your calf complex, and long tendons run into the foot to control your foot, kind of like a puppet or like a pulley system. And so when we're doing big global movements like towel scrunches, we're actually using a lot more of our extrinsic muscles. And so a lot of us runners have tight calves, tight lower legs to begin with. So if we're overusing those muscles and we're just repeating that pattern with our exercises, we are strengthening, but we're not strengthening the pattern that needs to be strengthened. Kate is smirking at me because I'm talking to this like she doesn't know this, and she's like the biggest expert on this.
No. I'm smirky because I love it. And because I recently heard that you're the foot person, and I really love the foot too, but I don't treat as many patients as you do. And you're slowly becoming the foot person. And so I'm really pleased with this discussion, actually. And I completely agree with you.
Yeah. So this is why doing exercises that emphasize foot intrinsic activation, so looking at more of like a foot push-up or arch dome, both of which I'm not going to attempt to explain on a podcast format. Ask someone who can show you, because I can guarantee you most people don't know how to activate foot intrinsics without scrunching their toes. And this is the problem. This is why people have foot pain, because they're overusing that other pattern. They don't have the stability inherently to their foot. Sometimes this is like a really esoteric concept for people. So I will compare it to like your core muscles, right? So people understand the strong core is important for other movements, right? Because you have to be stable at the center. So the intrinsics are like your abs of your foot. Okay. So if you don't have a strong foot core, then you can't use the other muscles properly.
And you won't have a six-pack on the bottom of your foot.
I know. Most importantly, your foot will not get on the front of Muscle and Fitness magazine.
I'm sorry, I had to. I just love it so much. You're totally right. All of this is correct.
Yes.
I wholeheartedly agree.
Yes. And so this is why I'm obsessed with the Mobo board. And I've got a whole library of exercises that I have that are really geared towards this. And this is why I'm the foot lady now, because it's my favorite thing to treat. It's
at least you're not the bag lady.
That I am not.
You're the foot lady. That's right.
Lady.
Yeah, that's good. Lady. So I like it. I like it a lot. Now the foot is actually really fun. And I think it's just because we're runners. And when you think of running, you think of the feet and how the foot hits the ground and how the force transfers all the way up to the rest of your body. And by strengthening and mobilizing and making sure it's moving correctly, you can really have a whole impact on the entire chain.
No matter what type of shoe you wear, if you have orthotics, if you don't have orthotics, if you use inserts, if you don't use inserts, I think doing foot strengthening is important. I actually think it's kind of number one. I'm always interested to hear your perspective on orthotics, Kate. I think it's a challenging aspect of I think what we do. And it's a very case by case thing. This is not something where we can just give a blanket answer to. I know personally what I say is like, okay, well, some people definitely benefit from them either temporarily or permanently. I usually like to keep people on the temporary side if I can. But my most concerning thing is like, I don't want you to be in orthotics and also not doing your foot exercises. So I want to hear your perspective on this.
Well, the thing about orthotics is there's several types of orthotics. Let's start there. So you have orthotics that are over the counter. So Superfeet, I can't remember all the names of them. You can buy them for like 30, 40 bucks, or at least that's what I think they're, maybe 60 bucks. You have those orthotics that you can buy over the counter. And those orthotics typically don't last more than 3 to 4 months, even though most people wear them for several years, because that they were never really educated on how to wear those particular orthotics. And then there are orthotics that are only really control the rear foot. So by your heel or your calcaneus. So the actual mechanism of the orthotic just manages subtalar and talocrural movement. So that's that ankle complex. And then it usually ends about midfoot, and you might have some like floppy material in the front, but it's not really doing anything. And then we have full orthotics that are from the heel all the way to the toes. And there are things that are happening throughout the orthotic, managing different components of the foot. And then there are custom orthotics that can go either way. They can be full orthotics or they can be partial orthotics. And those custom orthotics, usually you have to step into a mold. Somebody does a bunch of measurements. Sometimes it's just 3D printing. It depends on who's doing it. And those orthotics are really expensive, usually several $100s. Sometimes I've heard up to like $600. And they tend to last a lot longer. Those can last several years, but they still eventually have to get replaced. And then, of course, there are orthotics that are made of different materials. So some are softer, some are really, really hard plastic. But anyway, there's several kinds of orthotics. So any kind of discussion we have about orthotics, you have to start there. And you have to start with the idea that they're all different, just like us. And maybe one orthotic will work for somebody and another one will work for somebody else. Now, if we step back from that and we think about orthotics in runners, I think that there is definitely a place for orthotics in injury. And I think there's a place for people who are lazy and don't want to do the work, which I hate to say, but there's a lot of people out there and that's okay. It may not even be lazy. It may be that their life is so crazy that they just can't get it done. And all they want to do is go out for a run and the orthotics are the one thing that allow them to do that. In that case, I'm all for it. Use them. Okay. But I don't think in general, we should rely on orthotics if we don't have to. And that comes back to the idea of strength. We all need to be stronger as runners. It's one of those things for several years that we did not address as a community. And now we know it is something that we need to do. So getting stronger in the foot, getting stronger in the hips, getting stronger in the legs, learning how to breathe and have core strength are all going to impact whether or not you need orthotics. And I know that seems crazy, but if we break it down, every time your foot hits the ground, your foot hits from the heel generally, and it's in a more rigid position, and then it comes into pronation. So it unlocks and then it goes back rigid to push off. Well, the things that actually impact how long it's in pronation, how much pronation there is and what's happening, or how much supination, that's that locked position that your foot is in, actually is up high. So if you don't have good control of the tibia or the femur or the hip, that's going to change how your foot lands. So we need to really be strong and work on all of that so that we don't have to rely on orthotics. I think that they're sometimes overused, but at the same time, I will have my patients use them if they're in pain and the choice is running with no pain or not running. I will put the orthotics in. Is that what you wanted to know?
Yeah. No, yeah. I love listening to you talk about these things because I mean, we have the same knowledge base, but it's always fun to hear how you frame it and talk about it.
Yeah.
I think there's a time and place for them. And for some people, they do allow them to run. And I'm like all for that for sure. One thing I wanted to mention, one thing I'm big about in my practice is, so if we can't control the foot, then we can't control the hip, right? You know, if we do all these hip strengthening exercises, but we never really talk about how to focus on the foot and what the foot should be doing when we do single legs, a lot of our exercises are single leg exercises, right? Because that's how running occurs, is one leg to the other. And so you've got to be really good at controlling that. Being able to stabilize through the foot actually allows us to actually even use our hip at all when we do those exercises. So it's not something, this is another plug for why you shouldn't just Dr. Google everything, right? So one experiment I do is, when I put someone, just ask them to stand on one foot. It could be on the floor. It could be on an unstable surface. It can be on the Mobo board, which I know I've talked about my love affair with that before on the show.
At least 3 times today. We should be sponsored by Mobo board, by the way. Anyone out there listening that is in charge of that?
I know I'm so close to contacting them because I haven't personally sold, but I have recommended and sent them so many customers.
God, me too.
So yeah, asking them to stand on one foot and be like, okay, like, what do you feel? And if they just talk about, well, my foot's getting tired, my calf is, getting tight or cramping, they're using their legs so much to stabilize. They can't even get into their hip to strengthen it. So, that's having a firm foundation or strong foundation is a prerequisite to even being able to do a lot of the functional exercises that we give our patients.
Mm-hmm. I also sometimes make them do that same thing and then teach them how to activate the glutes and see how that feels in their foot and their lower body, and kind of to show them how they work together. We've already kind of started to dive into treatment of plantar fasciitis, really, or fasciosis, however you want to say it. But we definitely do a lot of full chain, right? So it's all about, foot strengthening, okay, glute strengthening, core strengthening, back strengthening, breathing, running form, learning how to control that pronation, that supination, eccentrics, which are the kind of exercises that you do where you're lengthening the muscle. And then, of course, we do a lot of neural mobility. So that's in the manual therapy column. So making sure the nerves are moving correctly, lots of hands-on soft tissue through that whole lower extremity, really foot, lower extremity up into the hip a lot of times. I frequently am treating the pelvis and the back, perhaps orthotics, perhaps not. And then really just a lot of retraining, like teaching a person how to use their body in running and running positions. Like you said, single leg, plyometrics, hopping from one foot to another, jumping, that kind of thing.
I mean, I guess we'd be remiss not to mention like night splints or the Strasbourg socks out there.
Strasbourg socks.
Strasbourg socks. Wear them with your knickers. No.
They can actually be really helpful. I've had a lot of patients that do wear them, and it's kind of that tipping point for treatment. Yeah.
I mean, I've read a lot of articles about it and like studies that they've done, which most of it is pretty positive. They're most effective early on in treatment. Sometimes they can be effective no matter when you use them, but I've seen several studies say that if you use them within the first 2 months of onset, that's when they're the most effective in terms of reducing pain, improving function, and kind of helping with the rehab process.
Yeah, that's great. And of course, dry needling, cupping, massage, joint mobility, that kind of thing.
Mm-hmm. Again, someone who can assess your body and find out where your mobility deficits are and what needs treatment, right?
That's right. And then if it's not working in PT, there are other options. But again, if it's not working in PT and they're not addressing all the things that we've talked about, perhaps find another PT is the first thing I would say, right?
Right.
Somebody that can really address running form, that can really address the entire kinetic chain. And I think we've said that every single episode since we started. Those are the most important things. But then there are non-PT related ways to deal with plantar fasciitis.
Yeah, and there's a variety of them out there, including like surgical procedures and everything. And for some people, those things do work. For certain cases. But I think at the end of the day, having a good PT, and you're still going to have to rehab and do the strengthening work and change the pattern that led to it in the first place, right? So I think that's more of an adjunct, really, than your silver bullet in most cases, right? But plantar fasciitis being one of them.
Yeah, and I've had patients go and do 10X procedure, which I thought was could be really helpful, and then they're in the boot after for a little while, and then PRP is something I have heard. Shockwave about that, and those things can be used in conjunction with what we're doing in orthotics and everything else.
Mm-hmm. Yeah, so how I kind of wanted to wrap up our discussion was talking about what do we see in a runner's gait who has plantar fasciitis. And, honestly, we'll see a lot of similar things with different pain presentations, right? I'm going to talk about my two big ones, and then I'll let you kind of expound upon it. So control of pronation, and then seeing people with a calf dominant gait. And so I'll go back and explain those. So controlling pronation. So this is not only an amount of pronation. So we think about overpronating being too much pronation, and then also speed of pronation. So how quickly is it happening? To really gain an appreciation for the nuances of those two things, you have to see these things every day, because there is a big difference between how fast different people pronate, and you can really pick it out. And that's why, having someone who's skilled in gait analysis can look at that for you. That's kind of when we were talking about the anatomy before, any kind of like twisting or forces that are going to go through the plantar fascia are greatest when we can't control pronation. So that's a big thing that we're going to look at. calf dominant gait is, I think, a word that I made up.
No, I don't think so. If it is, then we made it up together.
We made it. Yeah. So this is a phenomenon where runners pushing too much with their calf and not getting their glutes involved. And this is most people, I would say, especially the first time we look at their running gait. And this is really what we can see is sometimes we'll see more vertical movement because the runner is pushing up rather than through the hip. Mm-hmm. We'll also see the calf fire super early. You can see kind of the muscle ripple very, very early on in gait. So what this does is this tightens up that whole posterior chain of fascia that we were talking about and can tighten up through the foot. And also we're just kind of, we're really skipping over big powerhouses of the glutes in that situation. So those are the two I wanted to talk about.
Sure. Leave me with the rest then. No, I'm just kidding.
I did.
I agree with the calf dominant gait. And one other thing I'd like to say about that is it's related to hip extension, right? So if somebody doesn't have enough hip extension or doesn't know how to use it, and those are two different categories. So you may actually not have hip extension on the table because of really tight hip flexors, just tightness in the whole front of the body and hip area or abdominal wall. And if you can't get hip extension because of that, or you cannot have hip extension because you don't have strong enough glutes, and you can't figure out that kind of pattern. And so whenever you can't use those glutes or you don't hip extend, then you're forced to use your calf a little bit more. And that's where you'll really get that kind of calf dominant gait. And we do see it a lot. And one of the things that we often do to help teach that is, one, obviously free up the anterior or front of the hip, to get the glutes firing. And then we use a lot of rolling patterns and that type of thing to like get that pattern down so people know what it feels like to get the glute going, what hip extension actually feels like, and then start backing off of the calf. So I think that's really important. The other thing that we see in terms of gait mechanics is that whole hip drop, what we call femoral internal rotation, or you might see knee valgus where the knee dives in, and then relating back to foot pronation. So that pattern of everything kind of diving in really does contribute to any plantar fasciitis as well. So if you're somebody who you're wondering what the heck is going on, and you stand in front of a mirror and you try to do a squat and you see your knees coming in and you look at your feet and they're kind of the front of your feet are splaying out, then you know you've got some trouble there in terms of that whole complex. You can, and if that's okay, then do it on a single leg and see if that shows up there. It usually shows up in a squatting position, and running is a single leg squat over and over and over again. So if you're seeing that in front of the mirror, then that's definitely part of what's contributing to that plantar fasciitis or plantar fasciosis. Even higher up the chain, right? So if you are unable to extend through the hip, it might be because you're overextending through the TL junction, or where that thoracic or mid spine hits that lumbar spine, right? So if you're not able to control that whole diaphragm, pelvic floor piston, where you're breathing appropriately and you're getting that core stability, you might not be able to extend that hip, and you might be over relying on your foot and your gastroc. Kacy talked about vertical displacement, so that up and down motion. So if you're somebody who pushes really hard and goes really high instead of forward, or if you're bouncing a lot, it's the same thing. Then you have to think about how much you're coming down on that foot and how you're landing on that foot. Those are all pieces of it when it comes to run gait mechanics. So again, if you are having plantar fasciitis or fasciosis issues, you can certainly find somebody that does gait analysis. We do online gait analysis actually at precisionpt.org as well, not just in person, which is kind of cool. So you don't have to live in Atlanta to come get it, but you certainly can.
Yeah, and it can be super beneficial. I mean, looking at someone's running form or run gait gives us so much information that, you know, we use other diagnostic tools and tests to hash these things out. But almost all the time, like I do all of the stuff in the room first, and then I usually go and see the gait after. And a lot of the things correlate between the two. So we can get a lot of information, and it can be really helpful, even if you're not able to come into the clinic. So it's a great option.
That's right. And you can tell a lot from a person's shoes too, like even the upper part of the shoes or the top part of the shoes, the back where the heel cup is, and then the bottom of the shoe or the sole of the shoe, you can see, how people are landing. And so even pictures of those with an online gait analysis can be really helpful. The other thing in terms of treatment that we didn't mention that for some reason it just came to my head was blood flow restriction training. Or BFR. And so that can also be a really helpful thing when we're going through any kind of lower extremity or foot and ankle injury.
Yeah. I think we've mentioned it before on the podcast, but what BFR lets us do is it lets us mimic loading the body without actually loading the body. Because if we think about injuries as a load tolerance problem, we need to find a level that is safe and appropriate depending on where someone is in their healing process. And so BFR lets us kind of stimulate the change that we need without actually stressing out the tissues as much, which is why it's really fantastic in a rehab setting.
Yeah, absolutely. All right, Kace. Well, I think that'll wrap up our plantar fasciitis OSIS episode. I think that was great in terms of what we're covering. And again, as you said, and as one of us always says, if you ever have questions about this kind of thing, feel free to email us.
morethanmiles12@gmail.com.
Yep. So you can email us there. You can reach out via social media. We always love to hear from our listeners. And also, if there are topics that you're interested in or injuries that you're interested in or anything like that, we'd love to hear because we really do try to create this podcast as like a holistic, wide lens of running, all the way from injury to mental health to safety to fun stuff, right? So let us know what you think.
As you can tell, we just hate talking about all of this stuff.
Thank you so much for joining us today. We hope that it resonated with you and that you learned something. If you enjoyed this podcast, please rate and leave us a review wherever you get your podcasts. It really helps increase our visibility within the platform so that more awesome people like you can find us.
If you'd like to support us further, pretty please, you can visit our Patreon page at patreon.com/morethanmiles. That's www.patreon.com/morethanmiles. Or for a few dollars, you can help the show grow and keep going, as well as receive exclusive perks like monthly Q&As with us. Until next time, remember to run the mile you're in, and that training is so much more than miles.